The rise in the number of medics who have died of COVID-19 while on the front line has sparked an uproar, with the medical fraternity claiming that the shortage of and supply of substandard protective gear is exposing them to danger. And as chemutai goin reports, a doctor and 2 nurses have succumbed to the virus. This as COVID-19 positive cases in the country rose to 9,726 after 278 more people were confirmed to have contracted the disease.
As doctors continue to come to terms with the death of their colleague Dr. Adesa Lugaliki, who succumbed to COVID-19 related complications on Friday morning, they mourn a woman who has been hailed by many as a selfless and patient doctor. What will stand out to be her goodbye message to fellow soldiers on the front line?
On Wednesday this week, she wrote us a message, her last message, which was, "The soldier has fallen."
It does injure the morale. And this is because, as a doctor, it could have been any one of us. As we speak now, we are not sure. We're not assured of our treatment. We're not assured of care of our loved ones.
As COVID cases continue to grow, and with the expectation that they will rise to the occasion to play their role, the doctors have turned the heat on the government, demanding the fulfilling of a pledge to provide comprehensive health insurance for frontline health workers, in light of the fact that already close to 300 of them have contracted the disease, with 3 registered deaths, 1 doctor and 2 nurses. Counties also urged to identify special areas that can be used as isolation areas for health workers.
We today appeal to you directly. Mr. President, your frontline soldiers are exposed, and we know you listen.
This is a demand because it's a right that the frontline soldiers be protected when they are fighting this COVID-19. And if it is not implemented, then the healthcare workers will seek further options on how they can protect themselves, including staying in their own houses.
The doctors' demands coming as the country registered 278 new cases, pushing the caseload closer to the 10,000 mark during the briefing done in Kwale County. As the government continued to assess county preparedness, Acting Director General of Health, Dr. Patrick Omoth, acknowledged the doctors' concerns.
As the numbers rise, of course, the number of healthcare workers that will be exposed will equally rise. But we'll continue to support the healthcare workers through the insurance cover that the government provides, through psychosocial support, and through any means possible at the disposal of the government.
With 3 deaths recorded and 99 new discharges, government officials continue to advocate for adherence to infection prevention measures put in place. With the Lungalunga border post in Kwale recording 139 cases since COVID struck, it reported 80 were linked to Tanzanian and Malawian nationals crossing the border, some through illegal routes. Governor Salim Vura vowing to instill more measures to curb the vice. At the moment, Kwale has only 9 active COVID cases, while on home-based care. Chemutai Goin, Citizen TV.